This conference will now be recorded.
Good morning, everyone. Today, I, Dr. Rakshanda Ahmed, your Part 1 MRCOG mentor, will be discussing an important topic that is Statistics Part 3. Already, two classes have been done, and this is the last class, that is Part 3. All the sessions are recorded, so recording session will be available after the class. If you are willing to give any of the MRCOG exam like Part 1 MRCOG, Part 2 or Part 3 MRCOG, then join the Beat MRCOG group by Dr. Yasmin Syed. So, if you are willing to give MRCOG exam, then join the Beat MRCOG group by Dr. Yasmin Syed. Hurry up, or the Ramadan discount is going on, so 25% off will be given. In this course, all material will be provided. Live classes will be there. Recording of the classes will be there. Subject-wise mock will be given. Exam-like mock series will be there. Flashcard and complete course is provided. So if you are interested, then you can join our classes, join the Beat MRCOG classes, and you can also phone on this number, that is 8949 or 861, or join the Telegram recall group, or you can also use give the WhatsApp call also. So let's start the class. The first question is, which of the following statement is true about the course study? I will read the question, you decide what will be the answer and then reply. So first question is, which of the following statement is true about the cohort study? Option A, it is not suitable for diseases with a long latency period. Option B, loss to follow-up can introduce bias. Option C, both A and B, and option D, none of the above. So what is the correct answer? So the correct option is option B, that is loss to follow-up can introduce bias. So correct answer is option C, and the explanation is that loss to follow-up bias only occurs in case control study, not in cohort study. And cohort study is not used for diseases with long latency period. It is the case control study. So I hope that you have understood the question very well and also the answer. So let's move to the next question. All of the following are elements of cohort study except option A. It involves calculation of incidence rate. It proceeds from exposure to outcome. Option C, it involves randomization of participants. And option D, it involves follow-up of the participant. So what is the correct answer? So the correct option is option C, that is, it involves randomization of participant. Randomization of participant occurs in experimental study, and experimental study include randomized control trial. So all, as we have discussed in the previous class only, that there are two type of study. One is the descriptive study and another one is the analytical study. In analytical, there are two type of study. One is the case control study, cohort, and case control cohort, cross-sectional, and ecological study. While there is also a third type of study, that is the experimental study, in which the study that comes is the randomized control trial. In descriptive, we have case series and case report. So in this question, it is written that all of the following are elements of cohort study except So it except it is option C, it involves randomization of participants. So randomization of participants occur in the randomized control trial. So I hope the question is clear to you and also the answer. So let's move to the next question. So the next question is, in a study was conducted by a researcher to determine the relationship between implanted medical device and connective tissue diseases. The researcher selected 5,000 individuals who had a medical device implanted between 2000 and 2002 from the medical record department of a hospital. These patient record were follow-up. So it is written a follow-up. So it is written follow-up up to the year 2019 for a diagnosis of connective tissue disease. It was observed that 20% of the individuals with medical devices had developed a connective tissue disease. So identify the study design in this case. So option is cross-sectional, option B case control, option C prospective, and option D retrospective course study. So what type of studies according to you? Please answer. So in this question, there is a hint given that it is a follow-up study. So what is a follow-up study? It is a cohort study. So cohort, as we have already discussed in previous class, that cohort study is also known as prospective and both prospective and retrospective study. So in this it was written that it was follow-up to the year. The disease has occurred, connective tissue disease, and the risk factor has also been given that it was the medical device implanted. So it is a backward looking study. So it is from outcome to the exposure. So it is what type of study? It is a cohort study, but what type? Prospective, retrospective. So the correct option is retrospective cohort study. So I hope the answer is clear to you that retrospective cohort study starts from outcome to exposure. In a prospective cohort study, it starts from the exposure to outcome. In the question, it was written that we have to see if the smoking is associated with lung cancer, then it will be a prospective cohort study. I hope the answer is clear to you. Now moving on to the next question. The next question is, which of the following conditions tend to increase the prevalence of a particular disease? So options are option A high cure rate, option B low case fatality ratio, option C short duration, option D immigration of patients. So what is the correct answer? Reply. So prevalence, what is the formula of prevalence? So prevalence formula is, in the previous graph we have done that it is the number of new cases at a given time period upon total number of population into 1000. So it can be also C, you can write C by N, where C is equal to number of new cases and N is equal to number of total number of population into 1000. So which of the following condition tend to increase the prevalence of particular disease? The option correct option is low case fatality ratio. So low case fatality ratio tend to increase the prevalence of particular disease. So now can you tell me what is the formula of case fatality ratio? Case fatality ratio. So the formula of case fatality ratio is equal to total number of deaths upon number of cases, total number of cases into 100. So I hope the answer is clear to you. Now moving on to the next question. When the data set contains too many extreme values, the most representative average value is. It is a very simple question, so answer. Option A mean, option B mode, option C median, option D variance. So what is the correct answer? It is written the most representative average value. So answer will be option C, that is median. So what is mean? Mean is nothing, that it is the sum of all the observations upon total number of observations. What is mode? Mode is the maximum number of times the value has repeated. Is the mode. Maximum number the value has repeated. Median, we have already told you that the average value, and variance is equal to standard deviation whole square. So I hope the answer is clear to you. Now moving on to the next question. What is type 1 error? So the option A is the probability of accepting the null hypothesis when it is false. Option B is the probability of rejecting the null hypothesis when it is true. Option C is the probability of rejecting the null hypothesis when it is false, and option D the probability of accepting the null hypothesis when it is true. So now answer. So the correct option is option B, the probability of rejecting the null hypothesis when it is true. So already I have told you that in the previous class that there are two types of error. One is the type 1 error and another one is the type 2 error. Type 2 error is also known as beta error. So in type 1 error, there is a drug that has come to the market that is usable for the society, but the drug analyst has rejected the drug. So it is the probability of rejecting the null hypothesis when it is true. Suppose a drug that has come to the market is PCM, and PCM is beneficial for the people, but the drug analyst group had rejected this drug. So it is type 1 error. While in the type 2 error, the drug that is harmful for the society, that is opioid or heroin drug that has come to the market, that is harmful, but the drug analyst group has accepted the drug. So it is type 2 error. So I hope the answer is clear to you. So now moving on to the next question. Which of the following is the appropriate measure of association in a case control study? So it is a very simple question. So now answer. Option is option A, odds ratio, option B, prevalence ratio, option C, relative risk, and option D, incidence. So what is the correct answer? So the correct answer is option A. Option A is odds ratio. So I have already told you in previous class of what is odds ratio. Odds ratio is nothing. It is the measure of association. It is the measure of association, that is incidence in exposed upon incidence in non-exposed. So then make a 2 by 2 table. Write risk factor, disease present, disease absent, risk factor present, risk factor absent. Then write A if the disease is also present, risk factor is also present. Write B if disease is absent but risk factor present. Write C if disease is present but risk factor absent. And write D if disease is absent, risk factor is absent. So it is true positive, B is false positive, it is false negative, and D is true negative. So make a crisscross. So it is AD upon BC. So it is odds ratio. Now next question is also very simple. Which of the following is a parametric test used to test correlation? Option A is Spearman, option B is Pearson, option C is Mann-Whitney, option D is chi-square, and option E is t-test. So what is the correct answer? Reply. Please reply. So the correct answer is what parametric test it is written. So parametric test is Pearson test. So option B is correct answer. So the explanation is Spearman and Pearson are correlation tests. You can remember that P for P. So Pearson is parametric while Spearman is non-parametric. Next question. This question is slightly tricky but it is very easy. In this question it is written the study Y involves a trial of 72 patients. It find improved outcomes in the treatment group being treated with drug B than those taking placebo. The null hypothesis that drug B makes no difference to outcome is rejected. Several larger studies involving several thousand patients clearly demonstrate that drug B makes no statistically significant difference to outcomes. So, what type of error has occurred in study Y? So, in this question, it is written that it has improved outcome in the treatment group, so that the drug B is beneficial, but the null hypothesis has rejected it. So, what type of error will be there? Now, answer. So, it is a type 1 error. So, option A is type 1 error. So this is an example of type 1 error. Now next question. This is the last question. The WHO defined maternal death as option A, the death of a woman while pregnant or within 48 hours of termination of pregnancy. Option B, the death of a woman while pregnant or within 7 days of termination of pregnancy. Option C, the death of a woman while pregnant or within 14 days of termination of pregnancy. Option D, the death of a woman while pregnant or within 42 days of termination of pregnancy. And option E, the death of a woman while pregnant or during labor. So, what is the correct answer? Answer, please. The correct answer is option D, that is the death of a woman while pregnant or within 42 days of termination of pregnancy. So, there are two type of there. One is the maternal mortality ratio and another one is maternal mortality rate. So what is the difference between maternal mortality ratio and maternal mortality rate? It is nothing. The formula is total number of maternal deaths upon total number of live births into 1 lakh. In this we have to multiply by 1 lakh. While in maternal mortality rate is total number of maternal deaths upon total number of live births into 1000. So in this we maternity mortality ratio we have to multiply by 1 lakh and maternity mortality rate we have to multiply by 1000. So I hope the answer is clear to you. So the explanation is according to WHO and CMAC, consider maternal death to have occurred during pregnancy or within 42 days of termination of pregnancy. Maternal death is the death of a woman while pregnant or within 42 days of termination of pregnancy, irrespective of the duration and the site of the pregnancy, from any cause related to or aggravated by the pregnancy or its management, but not from accidental or incidental causes. To facilitate the identification of maternal death in circumstances in which cause of death attribution is inadequate, a new category has been introduced, that is, pregnancy-related death is defined as the death of a woman while pregnant or within 42 days of termination of pregnancy, irrespective of the cause of the death. So I hope the explanation is clear to you and also the answer is clear to you. I hope you like my class. If any doubt, you can go join the Beat MRCUG Part 1 Recall group, and all the answers and all the doubt will be clear at that group. So thank you. And if you are willing to give any of the MRCOG exam, then join the MRCOG Part 1 by Dr. Yasmin Syed, or any of the MRCOG group, MRCOG part you are giving, then join that group. There is a special Ramadan discount going on, so join the group fast. In this, all the live classes will be there. Recording of the live classes will be there. All material will be provided. Exam like mock series will be there. Flashcard will be provided and complete course provided. And if you are interested, then you can also call on this number 8949 or 861, or you can message on WhatsApp also. So, what is the formula of success? So, hard work. So, do hard work, practice questions. MRCUG part 1 is an easy exam. It can be done in a one go only. No need to repeat part 1 MRCUG again. It's a very simple exam. Part 2 is very tough, but you can also do part 2, and part 3 is also very tough. So, what is the they are saying that success is a combination of hard work and strategy. So, do hard work and make a strategy that I have to complete this course or this topic by this much time, and do hard work and practice question. So, thank you.